Hi, I'm Laura and I'm one of the nurses here at Christie Clinic. If you're watching this video, you may have been diagnosed with gestational diabetes, have type 1 or type 2 diabetes while in pregnancy. Today we're going to be going over insulin injection teaching. Once you are started on insulin, the doctors will have you come in to see one of the nurses, and we will also instruct you as well in the office. The insulin teaching we're going to go over today. The doctors are going to give you, when you're pregnant, you're going to be checking your glucose levels multiple times a day. If you get to a certain point that they feel that your glucose levels are not staying in control with your diet and exercise modifications, they may start you on an oral medication or insulin. Once you're started on insulin, the doctor is going to prescribe you the correct insulin for you. It may be a fast-acting insulin combined with a slow-acting, and they're also going to prescribe you insulin needles. Once you get your insulin needles, they come in units. Each provider is going to tell you how many units you need to get and each time a day that you need to give them. And they're also going to let you know if you need to change the dosage you're giving yourself, which can be done at any point in pregnancy if your glucose levels aren't staying within the normal range. Whitney is here today, and we are going to do a sample of insulin teaching. It's very important with insulin teaching, just like when you're testing your blood glucose levels, that you're keeping the area clean. All of the providers recommend that you still buy the alcohol pads to wipe the area and let it thoroughly dry before administering your insulin. And you can get these at any local pharmacy. Again, just like your glucometer and your test strips and your lancets, we want you to dispose of all used needles in a biohazard container. Now, Whitney's doctor has recommended that she use 20 units of insulin every morning. So what Whitney's going to need to do before she draws up her insulin is you need to fill it with air, the syringe, up to 20 units. The plunger on the inside of the insulin needle, the top portion needs to be at the mark of the 20. And there you can see the lines within the needle. And once you get the top portion of the plunger up to the line of 20, you clean off your insulin vial as well. Wait till it's thoroughly dry. You put your needle in at a 90-degree angle, and you push all the air back in. Then you flip it over, and you want to start to let the insulin fill up. You're going to feel some resistance when the medication's going into the syringe. Before administering it, you want to make sure you have the correct amount and that there's no bubbles within the medication. Once you get your syringe filled to the line of 20 and there's no medication, air within the medication, you want to push a little bit out till you see a drop of the insulin at the top so you know that your needle is without air as well. You can go ahead and recap it before you actually give your injection. Sometimes it's easier, instead of recapping, just so you're not making sure you're not poking yourself, that you just wait until you're fully prepared to draw it up as well as whatever you prefer. We're going to go over sites for injecting. The providers prefer that you inject 2 inches away from your belly button. And that could be on any side of your belly, and we like the sites to be rotated. And before you inject, you can actually grab the skin, pinch it, clean it off with alcohol, make sure it's clean and dry, and then administer the insulin at a 90-degree angle and push it all in. And you need to hold that needle there for 1 to 2 seconds after you've administered the medication. The stomach area is going to be where the medication's absorbed the most rapidly. And then once you're further along in your pregnancy, some people may have bellies that are very taut, and it's hard to grab enough of the skin to give an injection. If that occurs, you can always use the backs of your arm, the fat skin there, or on the sides of your thigh. Normally the thigh is the easiest if you can't do the abdomen. Very important when you're injecting the insulin that you avoid going below the pubic line. And also when you're staying 2 inches away from the belly button, that you rotate sides every day, so that way you avoid bruised areas and hardened skin. We do not want you giving your insulin there because it may not be as absorbed quickly.